Good afternoon, everybody. Thank you very much for coming again. This morning I chaired a meeting of the government's COBRA Emergency Committee on the Coronavirus Outbreak. The First Ministers of Scotland and Wales and the First Minister and Deputy Minister of Northern Ireland, Deputy First Minister of Northern Ireland also attended, and we agreed to continue to work closely in the weeks and months ahead. We received a detailed briefing from the Chief Medical Officer and the Chief Scientific Advisor. Again, I repeat my gratitude to both Chris and to Patrick. There have now been 4 deaths from coronavirus in the UK, and our deepest sympathies are obviously with their friends and families. Our action plan, as you know, sets out 4 phases of our approach to tackling the virus: contain, delay, research and mitigate. We remain in the contain phase of the outbreak, but watching what is happening around the world, our scientists think containment is extremely unlikely to work on its own, and that is why we are making extensive preparations for a move to the delay phase. We're preparing various actions to slow the spread of this disease in order to reduce the strain it places on the NHS. The more we can delay the peak of the spread to the summer, the better the NHS will be able to manage. Patrick and Chris will give you some more detailed information on the latest advice we're giving the public today and how we expect that advice to change as the outbreak develops. As things stand, I'm afraid it bears repeating that the best thing we can all do is wash our hands for 20 seconds with soap and water. We'll also take questions, because I know there are lots of things that the public want to hear from our advisors about. But before that, I want to stress the following things. First, we are doing everything we can to combat this outbreak based on the very latest scientific and medical advice. Second, we have a truly brilliant NHS where staff have responded with all the determination, compassion and skill that makes their service so revered across the world. And they will continue to have this government's full support, my support, in tackling this virus on the front line. Third, we will set out further steps in the days and weeks ahead to help people protect themselves, their family, and in particular, the elderly and vulnerable. Finally, while it's absolutely critical in managing the spread of this virus that we take the right decisions at the right time based on the latest and best evidence. So we mustn't do things which have no or limited medical benefit, nor things which could turn out actually to be counterproductive. There is no hiding from the fact that the coronavirus outbreak will present significant challenges for the UK, just as it does in other countries. But if we continue to look out for one another, to pull together in a united and national effort, I have no doubt that we can and will rise to that challenge. And I'm now going to ask Patrick and then Chris to give their own perspective on where we are. Patrick, over to you.
Thank you very much. Numbers are increasing, and they're increasing across Europe and in the UK. And that increase in numbers is consistent with the fact that there is transmission of this within the community. The number that's particularly important, actually, is the number of people in intensive care, which shows that there are others out there who've had it, and that's come into seriously ill people in some cases who may have infected others before they got to intensive care. So we know that there is community transmission. In terms of the things that could be done to try and suppress the number of people that get this at the peak, push the peak into the summer, and also to protect those that are most vulnerable in society, we need to understand where we are in the epidemic and make sure that we take the actions that need to be taken at the right time. And those possible actions are laid out in the plan. They've all been modelled, and there are others that were looked at that are less effective than the ones that are in the plan as well. They've all been modelled, and we get together and review those numbers through SAGE, looking at the numbers on a daily basis with groups of mathematical modellers, people who understand disease epidemics, clinicians, virologists, other types of scientists with expertise across a range of disciplines. Those different options then can be modelled to give a certain percentage effect on both the peak and the number of potential deaths and the number of potentially very ill people. It's important that no single intervention on its own is enough to make the difference. You have to do things in combination, and you have to do them at the right time. Do it too early, you just end up with the measures not having any effect. So, for example, if you asked everybody with a mild sniffle at the moment to go into isolation, you get a lot of people who haven't got coronavirus, they've got some other circulating illness. In due course, that will change. So that we need to get the measures at the right time so they can be implemented properly and people can actually adhere to them, and it's sensible to make the difference that we're looking for. So those combinations we're going to look at and trigger at the right time in the right combinations to make sure that we have the effect that we're looking for. And that approach of being very driven by the data and very driven by the science is exactly why some of the measures we're taking may look a bit different from some of the decisions that others have made with the outbreak they've got in their country, which might be progressing at a different stage or might have different characteristics. So that's what we're trying to do, and Chris will say more about the details of where we are as of now.
Thanks, Patrick. Chris.
In addition to what Patrick's just said, I think that it's important to remember that both the NHS and public health professionals are already doing a very large number of things, and those are steadily changing as this epidemic goes on. So we started off very heavily concentrating on geographical issues, looking at fevers and other symptoms in people who'd come from areas where the outbreak had begun, and then when how it seeded out, including most recently to Italy. But as time is going on, for the NHS, for our public health colleagues, we're moving more and more to looking at people who have never left the UK to check that they might have coronavirus, and if they do, that they could be treated and isolated properly. And the key at this stage remains to find early cases, to isolate them, and where appropriate, to follow their contacts. We'll be making one additional change on the health side tomorrow. At the moment, we are screening everybody who's in intensive care for coronavirus if they have symptoms that are compatible with coronavirus, so if they have a very bad pneumonia. And we'll be extending that out now, as from tomorrow, to everybody who has a significant enough pneumonia or other respiratory tract infection to get into hospital at all. So that's a medical advance, a move forward. But I think what we're moving now to is a phase when we will be having to ask members of the general public to do different things than they would normally do. But I would repeat the point that the PM and Patrick have just said. It is important on this. It's not just a matter of what you do, it is also a matter of when you do it. Because anything we do, we've got to be able to sustain. Once we've started these things, we will have to continue them through the peak, and that is for a period of time. And there is a risk if we go too early, people will understandably get fatigued, and it'll be difficult to sustain this over time. So getting the timing right is absolutely critical to making this work. At the moment, the things that we are doing which are appropriate for any other significant respiratory tract infection are also appropriate for the currently very small number of coronavirus cases we have in the UK. So those would include washing your hands with soap and water, as the Prime Minister has said. It includes covering your mouth when you cough or sneeze, and disposing of tissues, as everybody knows. It also would include what anybody would get as advice from their GP, which is if you've got a very serious respiratory tract infection, you're sneezing everywhere, you've got a high fever, you've got a runny nose, if you phoned up your GP, they would say, stay at home, don't infect elderly people, don't infect your workmates. This is no different from anything else we would normally advise at this time of year. And remember, in terms of perspective, in an average year, about 8,000 people a year die of flu. It is very important we do this for all respiratory tract infections, and as with coronavirus, those who are older and those who have pre-existing health conditions are at greater risk. But we're now going to be moving into a position where, at the moment, as Patrick said, the ratio between people who've got coronavirus in the UK and other significant respiratory tract infections is very, very low. That is going to shift over time for two reasons, one of which is the modelling shows that the actual amount of coronavirus is steadily going to increase, and we're expecting the numbers to increase initially slowly but really quite fast after a while, and you have to catch it before the upswing begins. And secondly, the other causes of coughs and colds that are seasonal at this time of year are at the tail end of their period of maximum activity in the UK. So the ratios are going to shift very significantly. So we are now very close to the time, probably within the next 10 to 14 days, when the modelling would imply we should move to a situation where we say everybody who has even minor respiratory tract infections or a fever should be self-isolating for 7 days afterwards. And this is going to be the next step. We have not yet reached that step, but we are going to be reaching that step in the really quite near future. And this is what we wanted to lay out as the first step along a path towards trying to reduce, firstly, the delay of the epidemic. It's part of the overall contain, delay, research and mitigate strategy, and then to pull down the peak of this epidemic so that it is smaller than it would have been if we don't take these interventions. So that will be the next step. Thank you very much.
Thanks very much, Chris, and thank you, Patrick. I hope that's given some clarity about where we are. But let's please have some questions. Vicky Young, BBC.
Prime Minister, you touched on it there. You talked about public concern, and it's clear that some in the public are beginning to question why you're not taking those more aggressive approaches, if you like, that we're seeing in lots of other countries. And people are wondering why that's not happening. Are you confident you are doing enough to keep people safe? And a question too to the chiefs, if I might. Lots of people ask about flights from Italy. They haven't been stopped, and as far as we're aware, people are not being tested coming off those flights. Can you explain why?
Yes, I'm Vicky. I just really go back to the advice I gave earlier on, and really to repeat what the CSA, the Chief Scientific Advisor, and the Chief Medical Officer have said. It is really vital as we take these steps to protect ourselves and encourage everybody to protect everybody else, that we do it at the right time. It's not what you do. Of course, it's partly what you do, but it's when you do it. And what's happening, as Patrick said, what's happening in other countries doesn't necessarily mirror what's happening here in the UK, and that's why we're following the scientific advice in the way that we are. But on the back, do you want to say something about that?
Yes, I'll say something about that. So it's important to actually look and see what really works and make those measures. There are lots of things that seem intuitive, and you think, well, that should work, turn out to have very little, if any, effect. And one of those is actually airport screening. So temperature screening in airport doesn't really have much effect. It's worth noting that those countries that instituted it very early, some of their first cases came through that screening, weren't detected in the screening and then popped up. And some of those have stopped doing it now. So that isn't an effective measure. And other measures that people look at, so mass gatherings and so on, actually don't make much difference if you really look at it. And so those aren't the first things you'd go for. They're not the things that really help contain. And that's why what we're looking at is the things that really do make a difference, and making sure those are the things we concentrate on at the right time.
Chris. Should I just add one thing to that, which is, I think, important to remember that Italy, and I think all of us, our hearts go out to the situation in Italy. Yeah. They were the first country in Europe to actually ban flights at that stage from China, and they also looked at airport screening. And as you can see, this is not cause and effect, but that has not been a reason to actually slow down the epidemic in that country.
Good, thank you. Paul Brown, ITV.
Thank you, Prime Minister. Prime Minister, just to pick up on Vicky Young's question, other governments across Europe are taking more drastic steps now. Are you suggesting that perhaps that's due to political pressure rather than sound scientific advice? And are you absolutely sure you shouldn't be doing the same thing. And just a question to all of you, is it still meaningful to say that we're in the contain phase when the virus isn't being contained and we now have evidence it is spreading within the UK?
Well, first of all, I think that the best answer to that, Paul, is just that the phenomenon, the epidemiology, may be different from one country to the next. And I think it's very, very important that we in the UK are guided by the best and the latest scientific advice, and that's what we're doing. And just on your second point about containment and delay, as and when we may move into the delay phase, it's obvious that we're not abandoning contain, because clearly we're going to want to contain as well as delay the outbreak. It's just very important that the government, just because you move from one phase to the other, doesn't mean the ambition of containing the outbreak has been abandoned.
Could I just add to that, that when you start off in delay, most of the things you do are exactly the same as you would do in contain. So it's all about case finding and isolation. As you move through, beyond a certain point, that ceases to be an effective strategy. But at the moment, we still think it is useful to be identifying people based on geography, identifying early cases and isolating them as case finding.
Thanks. Beth Rigby, Sky News.
Thank you. Prime Minister, a question for you and then the Chief Medical Officer, if I may. Prime Minister, just 2 weeks ago in Italy, there were 153 cases of coronavirus and just 3 deaths. Now 16 million people have been quarantined, a reflection, if you like, of the public health challenge we are all facing globally. Is there a risk that in trying not to alarm and panic people, you are actually going too slow in taking these measures? And to the Chief Medical Officer, your Scottish counterpart said 4% of the population in Scotland might have to be hospitalised. If you extrapolate that figure across to England, that's over 2 million people. Do you accept that figure? Thank you.
Well, obviously, you're right, Beth, in the sense that there's no question that this is going to become a much more significant outbreak than it currently is. That's obvious to everyone. But it is vital that we take the steps that we think are necessary at the right time, and we follow the science, and that's what I think the public would expect us to do, to give them the latest information. Now, in the course of this week, obviously, we're going to be looking more at the detail of the steps that we could take as we ask the public to join us in a national effort to delay the spread of the virus, but we will be setting out that detail in due course. We don't think that this is the right moment. We still think that the best thing we can do is, as I say, to contain the virus.
And when you do it systematically, moving from one to the next, getting the right combinations, not ending up with a series of individual actions in response to things. So be in control of where you are in the epidemic, not in reaction mode. And that's really what we're trying to do, making sure that when we do things, we get that right constellation of things done to make sure that we have the biggest impact.
On the issue about 4%, what Dr. Calderwood, who I obviously speak to every day, was talking about was the reasonable worst case scenario planning tool, and that is rightly aiming at the absolute top of the range. The reality, I think there are probably 2 points to make on this. The first of which is the great majority of people who have this infection will actually have a mild or moderate infection that will be managed at home and indeed will not need any testing. They will simply feel unwell. We will want them to self-isolate for 7 days and then they will get better, and they actually won't touch the health service at all. A minority will need hospital care. The percentages, to be honest, are largely speculative. And it really will depend on how the epidemic progresses, which we're really in the early days of, and then how doctors who see people and nurses who see people as they come in, they will make decisions about whether someone actually needs to come into hospital or not. Because clearly, if you don't need to be in hospital, you shouldn't be in hospital. It's very much going to be about choosing the people who are going to benefit most from hospitals. And the percentages, to be honest, are largely speculative.
Thank you. Heather Stewart from The Guardian.
Hello. We all saw footage over the weekend of people squabbling over toilet rolls and empty shelves and so on. Is it just prudent for people to be stocking up on the kinds of things that they would need if they were going to have to stay at home for a week? And are you confident that as the outbreak escalates both here and in other countries, that you can keep shelves stocked?
Well, we're certainly confident that we have fantastic supply chains. I know that both George Eustace and Matt Hancock have been talking to the supermarkets, making sure that we keep things moving. Just in terms of preparations and where the public is, I think it's very, very important that everybody should behave responsibly and think about others. We will be setting out, as I say, in the course of the next few days, what further measures we think may be necessary. I stress may be necessary. We think it's probable that we'll go to a delay phase, but we'll be spelling out what is useful and appropriate for the public to do in the course of the next few days. So there'll be a meeting of the Scientific Advisory Group on Emergencies tomorrow, and then a further COBRA on Wednesday to consider the next steps. And Gordon Rayner, Telegraph.
Thank you, Prime Minister. A lot of people at home watching this now will probably be elderly in the over 80s category that we know is a high-risk group. Is the advice for those people still just to wash your hands more regularly and nothing else? Or are there other steps that you are suggesting that they should be taking to protect themselves? And also, can you give any reassurance that if we do get to a stage where people with any kind of respiratory illnesses need to self-isolate for 7 days, that you will be able to get food to elderly people who perhaps aren't used to ordering, shopping online, like other people might be able to? How are you going to identify those people and get food to them?
Well, on the medical advice, perhaps I could go to you, Chris, first on what we're saying.
One of the key things that we'll be coming forward with in the next stage of the plan after this is advice for older people and also those who are vulnerable for other reasons. So pre-existing health conditions, people who are vulnerable, we know from infections in general, for example, people who are pregnant have a slightly increased risk. There are a variety of other areas where we would be looking at, and we'd be saying we want to be able to protect these people particularly during this epidemic, and we will be giving advice based on their degree of clinical need. And that will be different for different people, and it sometimes will have to be tailored to particular individuals. But that advice is going to be the next stage. At this point, the thing we're going to be moving on to in the next 10 to 14 days is very much asking people who have got symptoms, however mild, to stay at home for 7 days afterwards, because that is a way of protecting the public, including older people.
Thanks. Patrick, you want to? Yes, and we'll, as I said in my answer just now, we'll make sure that we do everything we can to keep supermarkets stocked and the economy working normal. You'll be hearing a bit more in the budget on Wednesday about measures to support the economy against coronavirus. Jason Groves.
Thank you. Jason Groves from the Daily Mail. Lots of people will be very worried about it. Some people will be much less worried about it. What can you say to them? How many lives might this save by sort of pushing back that peak? And will the overall number be small? And Prime Minister, can I ask you separately? Last week you told us you were still shaking hands with everybody. It looked at the Commonwealth Day service like you weren't shaking everyone's hands. Are you in or out on handshakes now?
Well, let me just on the handshaking. We were all given an instruction not to shake hands, and there's a good reason for not shaking hands, which is that the behavioural psychologists say if you don't shake somebody's hand, then that sends an important message to them about the importance of washing your hands. So there's a subliminal cue there to everybody to wash your hands, which is I think I'm right in saying, Chris and Patrick, is still far more important. I think the handshaking issue, which is obviously a matter for individual choice, but the handshaking issue is much less important in tackling the spread of the disease than washing your hands. And sorry, and on your point about, I think that really ought to. I think you know the potential. Yeah, I think really.
Well, so the measures we're looking at are looking to try and reduce the peak numbers up to 50%, and to try to reduce the mortality, the death rate, as far as we can in the at-risk group. By 20 or 30% is the sort of numbers that you're trying to look at. That's what other people are doing as well. That's not unique to how we're approaching it. And those are the sorts of numbers you can go for. What you can't do is suppress this thing completely. And what you shouldn't do is suppress it completely, because all that happens then is it pops up again later in the year when the NHS is at a more vulnerable stage in the winter, and you end up with another problem. So it's to try and manage that in the most appropriate way in terms of the peak, move it a bit, suppress it, and make sure that we protect those people who are most vulnerable.
Thanks very much. Sam Lister, Express.
Thank you. A World Health Organization envoy this morning suggested that small gatherings are particularly risky areas, such as churches, pubs, that kind of thing. Is that something you can see the government making some kind of restriction on in the future, suggesting people shouldn't attend church, shouldn't go down the local pub? And should elderly people already avoid such areas, small areas of social gatherings?
Well, I'm going to ask Patrick and then Chris to...
Well, I made the point before that the large gathering, actually, it's the one that everyone goes for. But of course, you're either, as an individual who's infected, have a high probability of infecting a small number of people in a small space, or a very, very low probability of infecting a large number of people in a big place. I mean, there's only a certain number of people you can infect. So one person in a 70,000-seater stadium is not going to infect the stadium. They'll infect potentially a few people they've got very close contact with. And that's true in any setting, in the house, in a church, in a restaurant, or anywhere. So the chances of being infected are to do with the proximity to the person that you're with, or the people that you're with. That doesn't mean those are good things to try and stop, because the measures which come before that in terms of their effect on it are things like case isolation, as Chris Whitty has said, things like making sure that the elderly have the right advice to be able to look after themselves, and other measures before you get to things like that. And nobody's really going to the sorts of measures of really stopping those things. And when you do that, essentially you're saying stop all interaction, which you can't do and shouldn't do.
So it's safe for older people to go to church or now?
Yeah, well, at the moment, we have, as Chris Whitty has said, very low numbers still in this country, so the probability of coming across somebody in the church who's infected is very low. Now, as the epidemic progresses, of course, that probability becomes higher, and therefore elderly people in that situation then may take other measures. Chris, do you want to...
No, I think the only thing to add to that is the point about two points, actually, about sustaining it, that once we started down that path, we need to carry on through the peak of the epidemic, and that's important that we have things that are sustainable. But the second is, if people take the advice that we're going to be giving very shortly about if you've got symptoms, you stay out of circulation, whether it's work, church or anything else, that is a very major protection for other people around in society. So that's why we're going for this one early on in the path of this epidemic.
And just on that, so sorry, one other point is that the measures that will be recommended like those, some of them are about protecting all of us. So it's about us being good citizens to protect each other, and some of them are about us protecting ourselves, and it's important that we do both.
Okay, well, look, I thank you all very much. I think we've covered all the essential points that I think we feel that we need to make to you and to everybody. I hope that that's given at least some clarity, and people understand the logic of the advice that we're getting, the government is getting and transmitting to you about the range of options we have, in particular about the slightly counterintuitive advice about large gatherings, sporting events, schools. I hope that's coming across. We will be setting out more in the course of this week about what measures people and families can be taking as we move into the delay phase, as and when we move into the delay phase. As you've heard, what we're asking people to do now is to ensure that if they have serious flu-like symptoms, as happens every year, then they should do what they do every year and stay at home and not risk infection of their colleagues. And that's normal and commonsensical. The most important thing to get over is that whatever is happening in other countries, whatever measures are being urged upon us, be in no doubt, we are considering absolutely all of them, and in due time they may, of course, become necessary. But the clear advice from our scientists, from the CSA and the CMO, is that timing is crucial in tackling any kind of outbreak, any kind of epidemic. The timing of your measures is absolutely crucial. So this is clearly going to continue to be a big national challenge, and I think it's going to grow and become an even bigger national challenge. That is pretty obvious from where we are today. But I think it is also obvious to me that we know how to defeat it, and I think with a great national effort we will be able to pull together and do just that. But one thing is for certain, we will be keeping you fully informed. I think the best thing we can do is be as transparent with you as possible, to share our thinking, to show our working as we progress, and as I say, wash your hands. It never can be repeated too often. Thank you all very much indeed. Thank you. Thanks all. Good.